I don't know if there's any questions from, I mean, it seems like forever ago we met, so hopefully you enjoyed your holiday. But this is about where I left off, and because the digestive system, the majority is in the abdominal cavity, I do want to, just as a refresher, when I've talked about the chest or the thorax, the lining membrane is the pleura. In the abdomen, the lining membrane is the peritoneum. And if you've ever if you've ever heard of peritonitis, septic peritonitis. And that, when you hear peritonitis, that's a general inflammation of the abdomen. And a lot of times peritonitis comes from, well, say the dog ate a bone, say the dog ate a rib or a chicken bone, and something punctures the intestine. Well, if intestinal contents can leak into the abdomen, that's going to be feces, and that will cause an infection and a peritonitis. So, um, you know, sometimes it comes from, ruptured intestines, a ruptured ulcer. Sometimes they just have an overall infection. If you've heard of FIP in cats, that's feline infectious peritonitis, which is contagious, and then it will cause an inflammation of the abdomen. Cats with that come in with a big kind of swollen belly full of fluid. But those cats are contagious, and it's a virus. So anytime you hear peritonitis, we're talking about the abdomen, and then the mesentery is going to be the blood supply that is connected to the stomach and the intestine. And that's where it's bringing the blood flow. And I'm going to show you the omentum, and this just shows you the layers of the intestines and the nerve supply. And remember, the nerve supply is under autonomic control because the digestive system is considered smooth muscle, so we don't have conscious control. Now, the omentum, it actually consists of two layers. If you're ever involved in an abdominal exploratory, or when we, and hopefully we get to do dissection at the end of this term, when you open up the abdomen of the cat, like the first thing you're going to see, it looks like a net. It reminds me of like a fishing net. And it's this lacy kind of material. And if you trace it, it connects to the bottom rim of the stomach. So that's where it kind of anchors. And what it does is it connects the peritoneum to the stomach. So the lining of the abdomen comes together, joins the omentum, and attaches to the stomach. So there's all kind of this like lining. Now, sometimes doctors will remove some of this. Sometimes there's a layer of fat here that sometimes the doctor will take out. It can regenerate to some degree, but not completely. But you will see this, and it is a link from all the other abdominal organs to the stomach to the body wall. It's kind of like a connecting tissue. So we're going to start with the stomach, and I'm going to start with what I call the monogastric stomach, which is a species that has one stomach. We are monogastric. Dogs, cats, horses are monogastric, meaning we have one stomach. The stomach will store food, so it's a storage container, but the big function is the mechanical and chemical breakdown. Now, on your homework sheet, hopefully everybody got that, I sent it out Friday, I ask, or you need to know which parts of the digestive system have mechanical and chemical function, or just one or the other. Like the teeth are mechanical. The teeth crush and grind food, but they don't have like a chemical. Now, saliva is chemical, and that's in the mouth. So like the mouth has chemical and mechanical and chemical. In the stomach is going to churn. And what it does when food enters the stomach, it's going to mix it with the acidic contents and digestive enzymes, and it's going to break down the food by chemical, stomach acid, and mechanical by kind of churning. The stomach also helps produce a factor that helps B12 be absorbed in the intestine. So the stomach will secrete this factor, and it will actually allow B12 to be absorbed in the small intestine. Now, when food is swallowed in the esophagus, it is called a bolus of food. When it leaves the stomach, it becomes something called chyme. And hopefully you guys talked about that in nutrition. But when food, because it has been mixed with stomach acid, it has been churned about, it turns into this semi-liquid something called chyme. So when I talk about what's in the stomach and after, we'll refer to it as chyme. Hang on. Sorry, my son's out with the puppy, so he's like, "Does he have to poop?" I'm like, "Maybe, I don't know." Okay, now here's the breakdown. So you have to tell me which species. Basically, the ruminants are cows, goats, and sheep, and they have a complex stomach. But these are all the monogastric species, and obviously persons on here, pig would be on here. So there's some that are not on here, but it means they have one stomach. So we're going to start by talking about the monogastric stomach, and it is a C-shaped structure. It's right under the diaphragm. I don't know if anybody's ever had, if you've had really bad stomach pains or a stomach ulcer, and sometimes up under your rib, it feels like it's almost chest pain, but your diaphragm kind of comes up under your thoracic cavity and your stomach's right there. So sometimes people will get a pain and they might, say, "Oh, it's something in my chest." It's actually your stomach. And the stomach is right up under the diaphragm. Now, it's composed of some different things. There's three basic parts, which would be, you've got the opening, which is the cardia, and then you've got the fundus. Now, think about the fundus as this large storage container. Like, if an animal eats a very small meal, the majority of it's probably going to hang out in the body. It might go in between the fundus and the body, but if they overeat, or say you go to like a buffet and you're like, "I'm getting my money's worth," that fundus can stretch and accommodate extra food for storage. So fundus is primarily a storage container, and then the fundus is like, or the body is more of a mixing container. The cardia is the opening. Now, the way I remember the cardia is the opening, and hang on one second, sorry. Okay, so you need to know the opening versus the exit. The cardia, since it's higher up, it's closer to the heart. That's how I help remember. The cardia is the first opening, and C comes before P. So cardia before pylorus. So we've got the distal portion, or the end of the stomach, is called the pylorus. Now, it is made up of different parts. Pyloric antrum, or anti is before. So the pyloric antrum comes from the pylorus. Now, the pylorus is a narrowed sphincter. The cardia can kind of stretch and open a little bit, but the pylorus is a narrow opening. I will say, a lot of times, if animals eat, something they shouldn't, corn cob, swallow a toy, this is an area of concern because things can get stuck right in this area because it acts like a pump. And then this is the duodenum. So this is the first part of the small intestine. I'm going to come back to talking about the pylorus. It has folds called rugae, and what they do is they allow the stomach to stretch. If you look at an empty stomach on an x-ray, it'll look like a little ball, but it looks like it has wrinkles. Like sometimes you can see that because all those folds, it's like take a t-shirt, your t-shirt, and roll it up in a ball, and you've got all those like little wrinkles, and then you pull it out and it stretches. The rugae are the folds, and so it allows the stomach to accommodate a greater amount of food, and it allows more surface area for absorption. Now, there is some absorption of, you know, a little bit of nutrients, some water in the stomach, but most of the absorption is going to happen in the small intestine. But a little bit does occur. And in dissection, I encourage everybody, I'm like, open the stomach of these cats. And, you know, we found very interesting, a lot of hairballs. We found some parasites. We found a creature, I'm guessing was a mouse. We probably could have put it back together. We did not. But, you know, so some of these cats had full stomachs, empty stomachs, but you can open the stomach and literally see all those folds. Now, this is a piece of the stomach wall. So this is the surface that you would see, okay? So you've got the top of the stomach in the wall of the stomach, okay, which doesn't look thick, but you have these things which are called pits or gastric pits. All right, so there's like these, you know, and this is not, you don't see this with the naked eye. This is microscopic. But in these, you have different mucus neck cells that secrete mucus, because the stomach should have a layer of mucus. You have chief cells and parietal cells, even endocrine cells, and they will secrete different things depending on the meal, depending on the animal eats. And so we're going to talk about what is actually secreted, but it comes from those pits. One of the first things, and I don't know if you guys have talked about that, and hopefully everybody's still with me. I've got more participants here. If you've gotten in late, a lot of people got in late today, make sure you put here. We deal with something called pepsin. Pepsin is a proteolytic enzyme. Is anybody alive out there? What does proteolytic mean? If something is proteolytic. Amen. It's right in the word. Pro meaning protein, lytic is lysis or breakdown. So pepsin is a proteolytic enzyme, and it begins protein digestion in the stomach. What happens when an animal, we'll be nice, we gave our dog a steak, or we gave him a few pieces of steak, very high in protein, meat high in protein, hits the stomach, comes from the esophagus. As soon as it hits the stomach, something called pepsinogen. Now, what's interesting in the stomach, a lot of these enzymes are secreted inactive. Pepsinogen is not active. Once pepsinogen is secreted, it will mix with hydrochloric acid. HCl is hydrochloric acid, that's the stomach acid, and it will activate into pepsin. So pepsinogen needs to be activated in the acid, and then you've got pepsin. Now, I'm famous for being weird and trying to think, how do I remember that? I'm like, I like a Pepsi with my steak. Pepsin, Pepsi. If I'm going to eat a steak, I want some Pepsi. Or maybe you remember P is for protein. However you remember it, you need to know what pepsin does and what its inactive form is, which is pepsinogen. So those chief cells in that layer secrete. Now that's when protein hits the stomach. Okay. Now, as the chyme is being created, it's going to naturally start to move, you know, because we're going in one direction. Okay, we're going to leave. We're going to go to this thing called the pyloric antrum. That is the last glandular portion. This word is important, glandular. The monogastric stomach secretes things. Things are secreted from glands. Okay, so the glands within the stomach that secrete it make it a glandular stomach. This is the last portion of that. There is an antrum and a canal and the pylorus, and it's going to open to the duodenum. As chyme starts to move here and move through the pylorus, there are cells right here, mucus cells and G cells secreting gastrin. Now, what is the purpose of those cells? They are more stomach secretions needed for digestion of the food. how this works, okay, is you've got acetylcholine from cholinergic neurons. So now remember, cholinergic neurons are a receptor of the parasympathetic system. We talked about acetylcholine, and I said acetylcholine is a neurotransmitter. It works with muscles, skeletal muscle, but it is also the primary neurotransmitter of the parasympathetic system. And if you remember, I said during parasympathetic stimulation, that's your rest and digest or rest and restore. So when the animal is eating and digesting, acetylcholine is released to stimulate stomach function and contractions. Gastrin is going to be released and histamine is going to be released. Now, all of this is essential to digestion of the meal. Now, when these are secreted, there's two times. Well, the main one is once food hits the stomach, you have gastric secretion. But remember what I told you, in anticipation of a meal, the stomach will sometimes secrete these substances, even if no food is present. Crinkle of a treat bag, the can opener will get these secretions starting to happen. So we have to be aware of that. It's not just the presence of food. So I've already talked about this. What happens is your dog is like, oh my gosh, there's the treat bag. The enteric, which means intestines, nervous system, stomach, is stimulated. And then acetylcholine will be released from the nervous system because the brain says meal's coming. Acetylcholine binds to its receptors in the GI tract. And then the parietal cells secrete H and Cl, hydrochloric acid. The chief cells secrete the pepsinogen, and the G cells secrete gastrin. The gastrin is a hormone. Okay, gastrin is a hormone. All of these are going to be released to begin digestion. Now, when gastrin gets to the stomach, because gastrin is a hormone, it is released in the bloodstream, not the stomach. Okay, gastrin is a hormone that when the hormone reaches, that blood reaches the stomach, it's going to cause the parietal cells in the stomach wall to release histamine. Acetylcholine also causes a release of histamine. This is an important part too. Histamine stimulates cells in the stomach to produce more hydrochloric acid. I'm going to make a little connection here for you. Well, when do animals release histamine at other times? Just give me an example of when a dog would release histamine. Could be from a fight, could be getting excited. When do a lot of people take antihistamines? What time of year? An allergic response. So sometimes in allergies and histamines going crazy, they get itchy skin, can also cause some stomach upset. You see, antihistamines, there you go. So now I'm going to tell you, dogs get something called mast cell tumors. It's a cancer, and a mast cell lives in the body normally. So people have mast cells. Dog has a mast cell. If he gets a mast cell tumor, sometimes that tumor stimulates and it releases its histamine granules. And what happens is when they get released, it causes the stomach to produce more stomach acid, and these dogs get a sour stomach. They might vomit. Almost all of our mast cell dogs that would come into oncology we would put them on Benadryl or an antihistamine because they are in a state where they are over-releasing histamine. And by doing that, we minimize histamine release and we hopefully reduce the level of stomach acid. So, histamine, everyone and when I think histamine, I think allergies, I think itchy skin, I think redness. But histamine also has a role in the stomach. And so I just want you to be aware that, gastrin is going to cause histamine release, and the histamine will will give us more stomach acid. Okay. Now, obviously, that was all in my brain. When food actually hits the stomach, it's entered, the stomach is going to start to stretch. And when it stretches, it's going to cause those cells, those neck cells, chief cells, to begin producing the same thing. We need to produce acid. The peptides are going to be released from protein breakdown. Because the stomach is starting to stretch, they're going to get enteric reflexes, vagal reflexes. If you remember when we talked about the nervous system, I talked about the vagus nerve, which goes down the trunk of the animal. It goes from the brain through the neck to the stomach. And when an animal has a vagal response, this nerve is stimulated, and it can cause a drop in heart rate, because when the nerve is stimulated, it can cause what's called a vagal response. Sometimes dogs that have excessive vomiting can get this vagal response and heart rate drops. If the heart rate drops low enough, an animal will pass out. We had a bulldog that would vomit so terribly strong that the owner says, well, he just falls over. And he did it at the hospital, and he was like, he had this massive vomiting episode and then falls over because of stimulation of this vagal nerve. So vagal reflexes, normal vagal reflexes aren't going to drop, they're going to drop your heart rate a little bit, but it should be manageable. Acetylcholine is going to stimulate those secretions. So you've got histamine and gastrin. Gastrin stimulates more histamine. Hydrochloric acid increases. I want you to know this number right here. It says stomach acid can be as acidic as 2.0. Okay. Base is 7.4. So that's how acidic your stomach is. It is that acidic. And that's an important number to know, because you need an acidic environment to digest food. So it can be as low as 2.0 in a monogastric stomach. And why is it acidic? Because the stomach is glandular and is secreting acid. Now, and if anybody has any questions about that, but you need to know that number, how much the stomach moves, okay, how much churning, somewhat depends on the meal, like how much they ate, what is the content of the meal. But what the stomach wants to do, and please understand this, because this part of the lecture, I want you to think about it this way. Okay, the stomach is processing a meal. It is sending that to the intestine, but they're not going to shove the whole meal to the intestine at once. So what they're going to do is it's going to mix, and it's going to send a little bit of chyme out, a little bit of chyme out. Think about an assembly line. If you were on an assembly line and you were, like you're sorting something, or you were like, you're inspecting it. What if the assembly line just kept sending everything, and you're like, it's overflowing, and you're trying to, can everybody put that in their head and realize the stomach is an assembly line sending stuff to the next part, which is the small intestine. The small intestine is going, hey, dude, I have to process this meal. Slow down or speed up, because you're not giving me anything. So it's got to be an even movement. How? And Sean, I was going to use that example, but I'm like, I don't know how many people are going to get it. But for I Love Lucy, there's a famous scene where they're working in a candy factory. I don't know if any of you, besides Sean and I, that know this, but she is this, like, it just starts going crazy, and she's eating the candy. Okay. But if you Yes, okay, good. I'm glad some more people are know what we're talking about. We're not crazy. But good. And yeah, if you just say, I love Lucy Candy Factory, I'm sure you can find the video. But what's happening is it needs to be a slow enough process. So there are pacemaker cells. Now, I hear pacemaker, I think of the heart, okay? Because the heart sets. There are cells, it's not like the SA node, this is a little different, but there are smooth muscle pacemaker cells. And basically what they do is they control the membrane potential, the action potential of those muscles, so that when they contract, they will actually, it'll stimulate a contraction and then it can slow it down and it can speed it up and slow it down so that things leaving are on a continuous motion, but it's not overwhelming the small intestine. So acetylcholine is the neurotransmitter for the intestines, for the smooth muscle. And then when it elevates resting potential, calcium can initiate that contraction, and then the stomach contents will move. Now, how much each part moves, it depends on its job. The fundus is storage. This is a good slide. This is slide number 39 because it tells you exactly what's happening. At each part, the fundus is like, I'm going to store everything. The body's like, I'm going to mix it. And then think pyloric pump, PP, pyloric pump. The pump is going to move that chyme to the small intestine, specifically the duodenum. I will ask you the order of the intestine. I don't want you to say small intestine. The pylorus pumps to the duodenum. Some people call it duodenum. It's like tomato, tomato. I don't care what you verbally say it, as long as you know I say duodenum. It comes out here and it's a pump. Now, how hard it moves, how fast it moves, it kind of depends on the contents. Now, I'm going to tell you that it's going to go from the fundus to the body. Those parts move, but not as strong. Once it gets to the pump is where it starts moving stronger. What's very interesting when we do dissection, and I have you guys feel it, you're going to feel the fundus in the body, and it's going to feel somewhat strong, but when you get down to the pylorus, it's going to feel thicker. And I could cut out a stomach and hand it to you, and you should be able to tell me where is the pylorus just by feeling it, because the pylorus is thicker because it's more muscular. Now, what happens is things are going to start to move down here. And then if it gets to the pylorus and the stomach goes, that's too big. Retro means backwards, right? Everybody likes retro stuff, or some people do. Pulsion is that pushing motion. So retropulsion is, let me get to a picture. Okay, if it goes here and the body goes, it's going to push it backwards. I'm going to give you an example. We saw a German Shepherd, big old black, gorgeous German Shepherd, came into emergency when I was in Anderson, and the dog was having explosive vomiting at home. And we could see on x-ray, there looked like there was something in the stomach. The owners were not sure. They're like, we haven't seen him eat anything. And we knew things weren't moving. We take him into surgery and we pull, there was a ball, a rubber ball stuck right here. So what happened was it was trying to push that. But I'm going to tell you, when we showed the owners, we're like, this is what we found. They hadn't seen that ball for 2 months. They thought he lost the ball. They were like, he has not played with that ball. So for 2 months, and it is possible that that ball was floating around in the stomach. If he vomited, it probably couldn't fit. I mean, remember what I told you, the cardia will stretch, so it got through the cardia. The ball was small enough to get through, but it was too big. What happened was it probably tried to pump the ball out. The pylorus pushed it backwards, tried to pump it out again. The pylorus pushed it backwards. Okay. And it could do that for 2 months and the ball could hang out up here. Do you see, does everyone see what I'm saying? I mean, the stomach can move things back and forth, back and forth. Now, I'm going to show you a video. So if you've fallen asleep, wake up. If you're like, oh my God, she's still talking. Okay. This is a dog. Does anyone want to take a stab at how big a Shih Tzu is? If you don't know what a Shih Tzu is, not big. They're probably less than 15 pounds. This is a video of an abdominal exploratory. Now, it's like 5 minutes, so we're going to watch it. And if you've ever heard of Weird Al Yankovic, it's a funny video, but I want to show you some things about it. So this says my dog ate my homework and everything else. So here's our guy, and he particularly looks kind of like a small Shih Tzu to me, to be honest. I'm kind of like, oh, you're a small dude. So, yep, about 15 pounds is right on. So goes to the vet. Okay, you guys haven't seen a ton of x-rays. I'm going to show you what you're looking at. Okay, here's the vertebrae. There's the ribs. Now remember I said the stomach kind of goes up under the ribs. So there's the last rib. That's T13. Normally, the diaphragm comes about like this. Oops. Oops. So normally the diaphragm comes like this. This whole thing is the stomach. It's a little bit amplified because of the video. This is all stomach. Normally intestines, which are right here, are kind of like going down here. Normally, if a stomach is full, we'll see it all about like right here. So the fact that this is all stomach on this dog, it's very big. Now, the stomach can stretch, but this is a little much. So they're going to take the dog to surgery. So what we do in abdominal exploratory, what's hard to see here is it's going to be packed off with gauze, because when you open the stomach, you don't want to get stomach contents out into the abdomen. What they're going to do is they're going to make an incision. This stomach is very stretched out. It shouldn't be this stretched out. So here's a little hole. They're going to find out what's in there. Some more chicken, have some more pie. It doesn't matter. Or more fry. Just eat it. Just eat it. Just eat it. Just eat it. Oh! Your table manners are crying in shame. You're playing with your food as some kind of game. Now if you stop the gas, you'll just have yourself a plate. So eat it. Just eat it. You better listen better to what you're told. You haven't even touched your tuna casserole. Oh, you better chow down or it's gonna get cold. So eat it. Oh, it gets better. We're not done yet. Open up your mouth and feed it. Have some more yogurt, have some more spam. It doesn't matter if it's your hand. Eat it. Eat it. Don't you make me repeat it. I agree, Tia. I've never seen anything like that. I've seen some stuff, but this is Q-tips. I just want to point out something. When you're watching this, now that he's pulled, normally when we do an exploratory, sometimes you see the intestines and the stomach, and they'll actually kind of be moving during surgery, which is good. The dog should continuously have peristalsis. Do you notice how weak and flaccid, like the stomach is just like laying there because it's been stretched out? I'll talk about at the end what my concerns are. The color is good. Actually, the color of this dog's stomach is not bad. It's maybe a little pale, but you've got blood supply here. So we'll keep watching, but I want you to notice how it's just like as he pulls out all this material, just crazy. Just keeps coming. And the stomach right now is just so, you should see, this is the bend. This is up more near that fundus. So the fact that this dog kept eating everything, this fundus keeps stretching and stretching. Now, I don't know if anybody thinks did this dog eat this the night before? 2 nights before? This dog's been eating this stuff for a while. And it probably just got to a point, alien baby. The guy calls it an alien baby. We don't even know what that is. He's just like, oh my gosh, more ponytails. So this dog has probably been eating this stuff. Yeah, Madison, I 100% agree with you. I'm like, we had a dog that had come to Northwood, and I'm not even kidding, had, I think by the time it was 10 or 11 years old, had its 8th foreign body surgery from eating like towels, panties, socks. They finally had to put a basket muzzle on that dog because, you can be good for a while, but it takes one day of forgetting to close your bedroom door. So they had a dog that had a basket muzzle on, socks or panties, 24/7. The dog, because we were like, after the 10th abdominal surgery, or 8th or 10th, but look at that. Okay. So this, I mean, and we're talking about a Shih Tzu stomach. If this was a Labrador, this would be like no big deal. This would be just like a day in the life. But, that stretched and stretched. So probably what happened is that fundus would stretch with all this stuff. The pylorus would be like, like I can't like push it out. So it pushes it back into the stomach. And then what happens, it fills and fills and fills. And then gets to a point where, it can't do it anymore. The other thing I'm concerned about is a dog like this, if we don't see peristalsis, there's medications. One is called metoclopramide. It's a drug called Reglan, and it will actually stimulate GI movement. So a dog like this sometimes will put on, this dog will probably, in our hospital, would stay like maybe 2-3 days after surgery because we have to make sure the stomach will return back to normal. That dog probably has to eat special for a while. Well, one, because we cut into the stomach, but just to let the GI tract get back to normal. And hopefully those muscles will start to contract. But there is a chance that there was some permanent damage from all that stretching where the dog may have to eat limited. And yes, these people need to hide their ponytails, panties, Q-tips, and whatnot. But one thing we look at in exploratory is also that blood supply to the stomach, because sometimes if it stretches, if the stomach looks a little purpley, or black, that would be like a dead area, and that would have to be resected. So the fact that this dog's stomach, the blood supply looked good, it didn't have good movement, but the mucosa, what we see on the outside, actually looked, or I'm sorry, the serosa on the outside actually looked decent. So did anybody have any questions about that? I always like, you know, when I do this lecture, I was looking for an exploratory. Let me show you one thing real quick. I want to show this for a second. Okay, this is actually a cat, but I forgot this video sometimes follows this one. Here is the stomach. You can see it's kind of bulged. Do you see this blood supply? That is coming from the mesentery. And do you remember when I said the omentum? Do you see how the omentum, and usually there's a lot of, this is fat, but the fat is embedded with that net that's called the omentum, and it extends from the inner body wall and connects to the stomach. So that is the omentum attached to the stomach. So hopefully this picture, this is only 3 minutes, so so this is packed off, and you can see that good blood. Now see how this is all stretched? Now, let me go back a second. Okay, do you see how this looks a little bit thinner? And look at that engorged blood supply, because it's being like, oh. And then do you see how it starts to narrow? This is the pylorus. So you can see how this is stretching. When you get here, it gets a little bit thicker, and then that's going to start to go down to the duodenum, okay? So you can see we've got the mesentery. This is the fundus all stretched. That's the omentum. The doctor right now is putting in something called stay sutures. Think about like if you had to hold up, sometimes what it'll help is the assistant will grab those stitches, and it'll help them pull up the stomach while the doctor, so they're gonna make a cut. They're just gonna see, they're packing it off so that nothing spills out. And you don't want, you know, the stomach will stretch, but you don't want a giant hole in the stomach. So you want to try to make a minimal incision where you can still get everything out. This little bit of bleeding is normal, so they're just going to extend the incision a little bit. Okay, so they're trying to trap. How many times have you seen your cat play with a hair tie? I have a cat that plays with hair ties. Thankfully, she's never eaten them, but some cats do. Now, cats have a lower incidence of foreign bodies than dogs do, but I love abdominal exploratories. It's like opening a Christmas present. We're like, what are we going to get? Sometimes the owner knows what they ate. Sometimes they're like, we have no idea what they ate. But you're always like, okay, this is quite a bit for a cat. Sometimes we've pulled out a couple. Did you see they can eat these for months? So again, this is not, a cat did not sit here and eat all these hair ties in a day. This cat was probably getting one here, getting one there, chewing them. Yeah, he's got a little bit of spillage here. They're gonna flush the belly. That's a big chunk. So they're just, so the doctor's gonna see if there's, look at that. I don't know if anybody is horrified right now. It does look a little bit like worms. All of those, but the whole reason I show these videos, well, first so you can see the anatomy of the live stomach, so I'm like, I can show you things, but it's also to explain that the fundus is large. Now, my older boxer that I had, he got into the trash once, got into the bathroom trash, and it was day 4 or 5 before he vomited, what he got up. So that trash, and he was eating and pooping, so I knew he wasn't obstructed. I knew he got into some things and probably ate them, but the fact that he could eat without vomiting, he did vomit one time after he ate it, but not much came up. And he was pooping normally, because if something is obstructive, if it can't go out one way, it's going to go out the other way. So the number one thing that I tell clients, or if someone says, hey, my dog got into this, I'm like, are they still eating? Are they nauseous? Are they pooping? Because then I know things can pass. But the stomach can accommodate. And like I said, it was day 5, and then my dog throws up, and I was like, oh, that's what she ate. So for a while, things can sit in the stomach. Now, obviously, like they were saying in the video, this cat could have been eating one here and there, and it just hung out until he accumulated enough in the stomach, just said, I've had it. So, and that stomach was pretty stretched. So, that's pretty incredible. Again, 36, they said, 0.2, 36. Okay, so, well, Sean, I'm going to tell you a funny story. What we usually do whenever there's a foreign body, and sometimes we are not, like I said, sometimes the owner doesn't know what it is, but usually when we take out a foreign body, one of us, and I've done it before, I put on gloves and I'll take it to the sink and I will rinse it and try to because what I usually do is we usually put it in like a baggie or something, and I always ask the owner, do you want to see it? I've sometimes sent them home with something like, do you want it? Kind of to, not necessarily to prove, but I'm like, well, and I will say probably about like 75% of the owners want to see it. They're like, yeah, like I want to see it. What did you get? But sometimes we're not sure, but we had a Labrador. I pretty much pulled out not me, the surgeon pulled out almost an entire towel. It had been chewed a few pieces, but there was a giant piece, and we were all like, how on earth did this dog eat this towel? I mean, I just think about a dog swallowing a towel, because it wasn't tore up in pieces. There was a large part of the towel was normal, but we took it out, we cleaned it off in the sink, put it in a big bag, and kind of showed the owner, we're like, this is what he ate. So yes, Sean, that's one of the perks of our job. That's why you guys went to tech school, right? Was to count hair ties and you take out his stomachs. That Strange Addictions show. So the big moral of the story here is this retropulsion that I was talking about. Because again, if for some reason something is, so here's the hair ties going in 1, 2, 3. They're all building up till this can't stretch anymore. They're filling up here. The stomach by nature is trying to push that stuff out the pylorus, and the poor pylorus is like, no, I'm not having it, and sends it back. The pylorus is like, this is too big, and it wants the stomach to digest it and make it smaller, so it pushes it back. But the stomach can't digest a hair tie, a rubber ball, a piece of cloth. So what happens is it just keeps floating around in the stomach. The stomach keeps trying to digest it. And what's going to happen is it's either going to get stuck eventually on the way out, or this is going to get so full. And again, one of the number one signs in obstructive dogs is this vomiting and repeated, vomiting here and there. Like that Shih Tzu probably vomited here and there. And what do most people say? oh, he got into something, he doesn't feel good today. You know, if a dog throws up here and there, I mean, Bo one day like threw up. I wasn't like, okay, let me watch you. He was eating, he was pooping, he was acting normal, he wasn't painful in his belly. So I just watched it. But if I have a dog that starts repeatedly vomiting and he's not pooping, I'm like, okay, that's a cause to be concerned. Okay. Um, I'm going to stop there since we're almost done and I want to talk about some other stuff. But does anybody have any questions as far as the video, what they saw, what I'm talking about? I'm going to tell you something mentally to just get your brain around is think about the stomach and the small intestine, specifically stomach and duodenum, as an assembly line. And because I'm going to be talking about when things are sent to the small intestine, they work together, the duodenum and the stomach. When we do dissection, I'm always like, find the duodenum. I tell the students, find the pylorus. If you can find the stomach and the pylorus, the very first part of the intestine is the duodenum. I'm like, it's all, I call it digestion central. The pancreas is there, the bile duct is there. So it's kind of like, boom. I'm like, this is where all of this digestion really begins and is key. So we're going to build on that. We're going to build on this gastric emptying and continue tomorrow. So if you don't have questions, I'll get this converted and try to get it sent out to you. You got the study guide. I know it's a little more lengthy, but this is a bigger section. So if you encounter questions, just email me. All right. Well, as long as you said here, you're free to go. You guys have a fantastic day. You too. And welcome back. All right.